All right, good afternoon or good morning, good evening, students, whatever time it is where you're looking at this. All right, this is going to be a video on how to use Docucare, okay? First thing you're going to do is purchase Docucare from the bookstore or wherever you get it from, and that's going to give you a code into the program. It's not a disc, it's just a code to access the LWW Docucare website. Once you've done that, I'm also going to send you an email that's going to have in it this information right here. It has a code to my class. I'll send that to you. That will put you in my class. Now, this is the Monday and Wednesday. Yours won't look like this. I'm previewing this as an instructor. So let's go into the Monday class. And what we're going to do is I'm going to preview as a student. Now, I've already done 2 of these, so I'm going to do another one. Now, when you guys are looking at it, you're going to see the weeks. Week 2, or actually it's going to start with week 3, 4, 5, 6, 7, 8, 9, whatever. You're going to build your patient assignment within the week established. You're not going to do it in the student-initiated clinicals because that's a jumble for me to grade. I like to have them set up by the week, and they're going to look what I'm going to see, just so you know what I'm looking at. In active classes, let me go to last semester, past student assignments, and you'll see week 4, 5, 6, 7, 8, 9, 10. You're going to see that pop up. So you're going to build your assignment in there. So now, let me go back to my classes. And again, we're just going to play with Monday. So my students will be in Monday, students will be in Monday, Wednesday, students in Wednesday. So I'm going to preview as a student. And I'm going to add a new patient. This is what you're going to do when you get to the clinical location, whether it be the morning of or the night before. So in your Docucare, you're going to add a new patient. Clinical descriptor. This is not a patient name or anything like that. So in our case, what we're going to do is we're going to have a male with COPD. And we're going to say that our patient has COPD bronchitis. We're going to get to that in a moment. When did your clinical start? We're going to just leave that as today in this time. How long has your patient been in the hospital? I don't care about hours unless they were just admitted to the rehab facility. So let's say they've been in rehab for 2 days. Don't go worry about the hours if they've been there for more than 2 days. Age. Docucare is not going to let you put anything in there that is not HIPAA compliant. So you're not going to put an actual age of your patient. We're going to say that this patient is 68 years old. So that's going to be a young adult, a young old adult, because he's 68. It falls in between the 65 to 74 range. Gender. This individual is a male. Okay, we're not going to worry about the maternity thing because we're not doing that. Race, if you happen to have it handy, great. If you don't, do not spend a lot of time looking for it. So let's just say he's white. Ethnic category, again, unless it's really obvious, don't worry about it. It's not that big a deal. Height, if you have it in front of you, which you'll get that information from the computer, you're going to learn about their computer systems on week 3 or 4, depending on how Ms. Vitalik does it. So we're going to say he is 5'9", so 69 inches tall. Weight, we're going to call him 185. You'll be able to get this out of their computer systems. So you're going to put that in there unless it's extremely hard to find, but we'll talk about that when you get there. So we're going to say he's 185. Marital status, unless it's really obvious, don't worry about it. Religion, again, unless it's right there on the cover, don't spend a whole lot of time digging for it. It's really not that big a deal. Advanced directive. Unless the patient has a specific advanced directive on their chart, everybody is a full code. So code status is going to be either full code, no code, which would be a DNR, do not resuscitate, meds only, or no CPR, depending on what they see in that advanced directive. So let's just say he doesn't have one on the chart, so he's going to be a full code. Isolation. You will not have a droplet precaution patient on my floor. You might end up having a contact, but in this case, we're going to say he's standard. Now, primary admitting diagnosis, we're going to select our source. We're going to search Lippincott's Nursing Advisor. So let's search it for COPD. Search, and bada bing, it comes up with all of these. Now, we know that he has COPD bronchitis because that's what's written down. But if it didn't specify which component of COPD, whether it's bronchitis or emphysema, we would just go with this one. But we know because they wrote it down that he has COPD bronchitis, chronic bronchitis. So let's go ahead and select that. And we're going to save. Now, once you hit save, you cannot change any of this information. So make sure you have it correct, or at least correct to the best of your ability. And save. Now, you're going to get this right here, how it's going to come up. Take a look over here at the medical diagnosis. You're going to see this wonderful little green stethoscope. That's going to pull up what we call a nomograph. If you click on it, it's going to open up a tab, and that's going to tell you your information on chronic bronchitis. It tells you about the diagnosis itself. It gives you the pathophysiology. You need to know this, okay? Because this is what's causing the problems for the patient. All right, that's actually at the cellular level what is happening. Causes are the etiology of the pathophysiology. What is causing the disease is the causes. The pathophysiology is what's happening. Risk factors, in this case smoking, but we know about this, incidents, complications. This is the information you're going to talk to me about at pre-conference so that I know that you understand what is happening with your specific patient. Okay, so we're going to take a look at that. And then as you scroll down, okay, let me highlight that real quick if we're going to need this. Okay, you're going to see what you're going to expect to see on assessment. That's going to be the history, physical findings. All right, these are the manifestations that you're going to see. This is going to be your as evidenced by. This is that which you can see, hear, smell, touch, or taste. Don't be tasting anything. Anyway, that's what you're going to find in physical findings. Diagnostic tests. This is things that may have been ordered for this person, like a chest x-ray, diagnostic procedures. And as you scroll down, you've got this little box right here, which is nursing diagnoses. Keep that in mind. We're going to go back to that later. It's going to save you some time. So, patient info, that's already been inputted. This is what you're doing the night before. Assessment, you don't know because you haven't seen your patient yet. But during the day, this is where you're going to put your information on the head-to-toe assessment that you're going to do on your patient. You have one job. Do your assessment really, really well. That's what I'm expecting. That's part of the skills that you're learning in MedSurg 1. Activities of daily living, okay? While you're on my floor, on the rehab floor, you are always, and I don't usually use that term, going to do a Morse fall risk scale for my patients, okay? We'll talk about that when we get there. But you can't do that yet. What you can do is you can look at the doctor's orders on about the 3rd or 4th line, and you're going to see a line that says activity. Activity is either going to be bed rest, which means this person is remanded to their bed. They will be using a bedpan, all right? They might have bed rest with bedside commode, which means you're going to assist them to the bedside commode. They might have bed rest with bathroom privileges. That's a nice one because you take them to the bathroom, they use the bathroom, then they go back to bed. They might be up as tolerated or up as ad lib, which means they can get up and do whatever they need to do. Or they just might be up with assist, which means you just assist them wherever they need to go. But that's where you're going to put this, okay? So chart new ADL assessment. You're also going to do this the day of clinical. Notes. If you make an error when you put in your patient info, you're going to give me a nurse's note right here saying what you did. Oh, sorry, this is a male, not a female. Gene was a guy, not a girl, or a girl, not a guy. Whatever, it doesn't matter. Nursing diagnoses, the bane of your existence. These are really no big deal, all right? Nursing diagnoses are not on the NCLEX. What is on the NCLEX is prioritization, goal setting, interventions, and rationales. So, yeah, that's why nursing diagnoses are important. That's why you're learning them, not so much for the nursing diagnosis itself. So you have this wonderful little button right here that says create a diagnosis using the Lippincott Advisor. You will not be using that during my clinical. It's too easy. You're going to be using this one right here that says create your own diagnosis care plan. Now, many of you are going to be tempted to go out and buy a care plan book, the Diogenes book. You can do that if you want to, but we don't test out of that book. We test out of this book right here. This is the book that you should be using when you're putting together a nursing diagnosis, because as you're doing that, you're learning about these different medical diagnoses that we're going to be talking about in class. That's why I like this book, not care plan books. And I'll know pretty quickly, I can't stop you from using a care plan book, but I'm just going to tell you right now, you're not helping yourself by doing that. So create your own diagnosis/care plan. So we're going to click on that. Documented that. We're going to do that now, whatever time you're in clinical at, it is 12:54 right now, 2:54. All right. The nursing diagnoses. Remember this little monograph back here that I told you about? Bada bing. That's where this thing comes in handy. Or you can go to your book. This gentleman has COPD bronchitis. So we're going to look in the back of the book real quick, and we're going to look up in the index bronchitis. Bronchitis, chronic, COPD. Okay, so we're going to go to COPD. I should look this up before I pulled you guys in here. But whatever. Look in your book. One of the nursing diagnoses we're going to have is impaired gas exchange. That's a good one for him because that's a very common thing with bronchitis, COPD bronchitis. So we're going to copy that. And we're going to go in here to the nursing diagnoses. Control V, impaired gas exchange. Okay? It is not resolved. It's going on. It's chronic. It's not going to resolve until this patient passes because COPD is not curable. You can treat the symptoms but not the disease. Diagnosis type, actual or potential. Potential just means something that's a risk for. Actual means they have it. In my clinical, you will not use risk for unless I give you special permission, and we'll talk about that later in the class. For right now, we're only going to use actual diagnoses. If somebody is in the hospital, they have actually something going on. So, actual. Diagnosis category, physiologic, behavioral. Okay, behavioral would be something like a knowledge deficit. Let's say that this individual didn't know that smoking 3 packs a day for the last 30 years caused their bronchitis. That would be behavioral. Okay, this is a physiologic, and in other words, what's going on is impaired gas exchange because of the alveolar capillary membrane. You're not exchanging oxygen across it. So it's a physiological diagnosis. Related to, this is not bronchitis. That is not the answer. That is a medical diagnosis. You are not allowed to say that. What you're going to do, or what you can do, is you can go to your book to COPD bronchitis, or you can go to your monograph and look at the pathophysiology. Pathophysiology. Changes associated with chronic bronchitis include hypertrophy, hyperplasia, bronchial mucus glands, increased globular cell, yada, yada, yada. In this case, what we have is increased mucus production. And if you look at that, you'll see that that's one of the things in your book with bronchitis, chronic bronchitis. So related to increased there we go. Control C because I don't like typing. Related to increased mucus production. Okay, that's it. That's the problem. That's why you have impaired gas exchange, because the increased mucus, as evidenced by, if someone has increased mucus production, what their body is going to be trying to get rid of that. And how are they going to get rid of that? Evidenced by productive cough. That's it. That's a nursing diagnosis right there. That's the whole thing. All right. Now, you are going to do 2 nursing diagnoses when you have a patient. All right. You're going to be working up 2 problems. I prefer the term problem. I don't like the term nursing diagnosis. But you're going to work up 2 problems. Each problem has the problem related to, that's the patho, evidenced by what you see, smell, touch, hear, or taste, and don't be tasting anything. All right. Now, interventions. Every problem that you're working up is going to have 2 interventions. One is going to be independent, and one's going to be collaborative. I will allow 2 collaborative, but not 2 independent. Now, this is where there's some thinking on your part. Independent are things that you can do as a nurse without having to get the authorization of another person. Giving a medication is not an independent intervention. It is collaborative because you have to have an order for it. All right, so intervention. Let's take a look at Monograph, or let's take a look at our book. Interventions for this particular thing. Hey, you know what? Smoking cessation. So let's think about something you can do as a nurse. Intervention. Teach patient, or actually, first you need to see if the patient wants to quit smoking. So assess if patient is wanting information about smoking cessation. Remember, test question. You cannot, you should not teach a patient about an intervention if they're not ready to learn. If the patient doesn't care that they smoke, they're 80-something years old, they've been smoking 3 packs a day for however long, and they're not going to quit, then it's really not appropriate to teach them about smoking cessation. So assess if the patient is ready to learn about smoking cessation. If this patient is 54, they might be. So frequency, during my shift. Rationale. This is when you're going to go to your book, okay, or in your lecture or whatever, and you're going to find out, why am I teaching a person about smoking cessation? Smoking cessation, quitting smoking reduces irritation, blah, blah, blah. Now, your rationales, you will be doing 3 rationales for each nursing diagnosis, must be cited from the book or the lecture. You do not have the information knowledge base to come up with the rationale for your interventions. You can be like, you know what, smoking cessation is good, but you know what, why do I need to do that? You're going to look that up in your book. So you're going to say Lewis, and this is the Lewis 9th edition, and everybody should have this. Lewis 9th, page 1723, or whatever page that is on. That is a cited rationale. If you do not cite your rationales, I will tell you you're unsatisfactory on your care plan. Evaluation. You can't do this until the day of clinical. Okay, that cannot be done before. That has to be done the day of clinical. So now, that was an independent intervention. Now, collaborative intervention. Let's say this person is getting a medication. Let's say they're receiving Tessalon. Okay, it's an expectorant. So, intervention, administer medication. You may not say that. I have to know what medication. Oh, crud. I'm not sure if that's spelled correctly, but Tessalon pearls, and the amount, 40 milligrams. Okay? And the route, PO. Frequency, how often are you giving it? Let's say Q day at 0900 at 9 o'clock. Rationale, we're going to get to that in a minute. But if you're giving Tessalon pearls, it's going to have an indication. It's going to tell you, why are they getting that medication? Now, the problem with that is I didn't cite my rationale. So you're going to find out why they're getting Tessalon, and we're going to get back to that in just a few minutes. So remember that you didn't cite that just yet, but that's a collaborative intervention. So there you go. You got an independent and a collaborative. Now, expected outcomes. This is how you're going to make your patient a little better during your shift compared to when you came in. So let's go back to the monograph. History, finding, expected outcomes. Wow. Okay, let's see which one applies to what we're doing. All right, this one seems like it will fit. Because if the problem is increased mucus production, okay, the patient will maintain a patent airway, and adequate ventilation. Well, that's really kind of cool, but it also needs to be evidenced by. AEB, that means as evidenced by, maintain O2 saturation at greater than 87% on room air, or whatever is appropriate for your patient. This is what you're trying to do during your shift, and the timeline during my shift. So what you have is a measurable goal that you can do during your shift. You are not going to get this patient out for a 26.2 mile fun run during your shift. It just isn't going to happen. So make sure that your goal, or that your expected outcome, which is your goal, is something that you can do during your shift. All right? It might just be making sure they don't get any worse. Now, rationale. This is the reason that you chose this particular nursing diagnosis. So that should come from your book. When you're looking through your book and you're looking up COPD bronchitis, it's going to have manifestations, nursing interventions, that kind of thing. This is the reason you selected this problem to work up. Now, that's going to be from Lewis 9th, page, I don't know, it might be on the same page as your other thing, 1723. So, I'm expecting 3 rationales. 1 for each intervention, 1 for the reason you chose that nursing diagnosis. Okay, that's it. Let's go ahead and save that. Now, you're going to do 2 of those, all right? Your first one is going to be the most important. Your second one is going to be the second most important, okay? So I'll let you choose those, and that's why for the first week, we're going to be working as teams. Orders. This is where you're going to put your patient's medications. Now, you're going to get these from the chart, and you're only going to be doing the medications that we are giving during our shift. This person might have 45 medications, but only 6 are given during our shift. I only want 6 medication orders. So let's add a medication order. Okay, it's coming from the pharmacy. Provider, just put John Doe, I don't care. Ordered on, you can go ahead and put the day that they were admitted. So let's say they were admitted to the rehab on Friday. Okay, add time really doesn't matter, 1300. Actually, I think you have to put the colon in there. 1 p.m. All right, 11 p.m. Type. This is a scheduled order. They get this every day. Source. We're going to search for this medication. Remember the test line I said earlier? Let's search that real quick. What's the other name for Tessalon? Tessalon. Okay. So there it is, Tessalon. Let's select that. Dosage, he's getting 100 milligrams. It's going to be in the doctor's order. Route, it's oral. It's a pill. Okay, so let's continue. Frequency, it's going to be repeating because he's getting it every day, every 24 hours, because he's getting it every day. And that's it. Let's go ahead and save that one. Now, remember that green stethoscope up here for the diagnosis? Well, guess what? You've got another one down here for the Tessalon. Let's go ahead and click on that, and it's going to open a monograph. This is what it tells you is it's an antitussive. All right. Actually, it's not an expectorant, it's an antitussive. My bad. It stops you from coughing. Symptoms: relief of cough. Maybe not appropriate, but whatever. Okay. So now we're going to go back to Docucare. We're going to go back to our nursing diagnoses, impaired gas exchange, and remember We didn't have a rationale, and I used the wrong one. I thought, okay, I made an error, but that's okay. Administer Tesla pearls. Why? Antitussive, and that's what it is, but that's not why they're getting it. Indications: relief of cough. That is your rationale. Now, then what you're going to say, comma, is that you received the information from Lippincott or Docucare, Monograph. That's it. That is a cited rationale for that. So let's go ahead and save that and go back to the orders. You're going to put all the medications in that are given during our shift. Now, we come off the floor at a specified time. You're only going to list the medications that are given while we're on the floor. Our shift ends at about 2 o'clock. So you're only going to put the medications in here that are given up until 2 o'clock. So even though we stayed at 2:30 because we do lunch. So that's where you're going to put your medications. Mar, you don't have to worry about that just yet. Eyes and nose. You can't do anything with that the day before because that is what you're going to be doing during your shift. Vital signs, there should be nothing in there the night before because you don't know. Diagnostics. This is where you're going to put diagnostic tests that have been done that actually have something to do with your patient. So this person has COPD. Let's say he had a chest x-ray yesterday and they found some infiltrate, or they found like a possible pneumonia. You're going to enter that for me. Now, I do not want you, add new lab, documented now, 1 o'clock. Department, radiology, select lab type. Other. Okay. This is where I want you putting, like, if they had a if he had a chest x-ray yesterday or 2 days ago, the information on what the radiologist said about it. I do not want you copying and pasting. I do not want you writing word for word. I just want you to give a short 1 or 2 sentence. This is what they found. Infiltrates in right lower lobe. And I spelled infiltrates wrong. There you go. Okay. And then notes, anything you want to put there. Now, let's say this was a CVC. Okay. CVC with diff. This is your normal ranges that are going to come up. Now, let's say this person had a low hemoglobin. Okay, the result was, I don't know, for some reason, let's say it was 10. Regardless, it's abnormal. So what I'm looking for, low, now these are all put in for you, okay? What I want down here in the notes section for any abnormal value that you have on any lab, I want your interpretation as to why that might be low, okay? So that would be an unusual finding for this guy, but whatever, doesn't matter. If there is a abnormal finding, I want your words down here as to why that might be abnormal, or why that might be like that if it has to do with their medical diagnosis. Immunizations, if you can get information from the chart or the patient the day that we're in clinical, go ahead and fill this in. Don't spend a whole lot of time looking that up the night before. All right? And that, when you guys are done with your Docucare, you'll submit it to me. I'll grade it. I'll send it back to you. Okay. That is Docucare and everything that you're going to need to do the day before. Now, we're going to go over this in extreme detail on our very first clinical day, so don't worry about it, but that's everything that you need to do, and I just did it in, what, 20-something minutes. So, hope you have a good day. Don't worry about clinical. We'll be fine. My job is to make sure that you guys know what you need to know to be successful. All right. And I hope you guys have a good day, and I'll see you when clinical starts. Actually, I'll see you when you get back to school.